Assalamualaikum and good evening. So, have you ever experienced a situation like that? Worrying about something or even nothing? Or have you even encountered anyone with that condition before? If yes, sorry to say, you might have general anxiety disorder. But before we dig into that, let us learn about general anxiety disorder and get ourselves aware of this mental health disorder. Here we go. General anxiety disorder, or in short GAD, is a mental condition where someone excessively and persistently worry about something and keep on feeling anxious over any matter, including relationship, financial, health, and work. So many people might have anxiety, but they don't know that they have anxiety. It is normal to have anxiety, but when it is taken into excessive account, for an example, like you have been feeling worried and anxious about a small matter for over a week, and it keeps on distracting you and also affecting your performance in your daily life, you might have general anxiety disorder. So, according to WHO, 3 to 5% adults are having and facing GAD problem, and statistically by WHO, it is proven that women are more likely to get GAD compared to men. To further look into this disorder and understand it even deeply, let us look into the signs and symptoms about people who are having GAD. So, some of the signs and symptoms of GAD patient includes excessive worriness, restlessness, fatigue, muscle tension, difficulty concentrating, difficulty of breathing, irritability, sleep disturbance, and also overthinking. However, some of the symptoms might be similar to stress disorder, and also to mention, stress might coexist in GAD patient, and some other problem like depression also might coexist in GAD patient. So, it is important for us to take note which are the main symptoms that makes up into GAD.
For the impact on daily life. Generalized anxiety disorder can have a profound impact on every aspect of a person's daily life. Let's take a closer look at how this condition affects individuals and their ability to navigate their work. First, relationship. Relationship can bear the brunt of GAD. Excessive work and anxiety can lead to strained relationships with family, friends, and partners. The constant feelings of uneasy might make it challenging to engage in social activities, leading to isolation and a sense of detachment. Second, work and productivity. GAD doesn't not just stay confined to personal life, it can infiltrate the workplace as well. Individuals with GAD might struggle to focus on tasks, experience difficulty making decisions, and find it hard to meet deadlines. This can lead to decreased productivity and even impact career growth. Third, daily tasks. Daily tasks that most people take for granted can become monumental challenges for those with GAD. Even simple activities like grocery shopping or answering emails can trigger overwhelming anxiety, making these tasks feel like unsurmountable obstacles. Fourth is sleep disturbance. disturbance are a common companion of GAD. Constant worry can make it difficult to relax and fall asleep. This lack of quality sleep further exacerbates anxiety, creating a vicious cycle that's hard to break. Fifth, physical health. The impact of GAD is not just emotional, it is physical too. The muscle tension, headache, and stomach problems can manifest due to the stress and anxiety. The body and mind are intricately connected, and GAD takes a toll on both. Second last is quality of life. Collectively, this challenge diminish the overall quality of life for individuals with GAD. The constant battle with anxiety can rob them of joy, experience, and the ability to fully engage with the world around them. And then lastly, how ended recovery. Support, treatment, and coping strategies individuals with GAD can reclaim their life. Understanding, empathy, and a willingness to seek help can make all the difference in their journey toward recovery. For the diagnosis and the treatment. Crucial steps in managing generalized anxiety disorder. Let's delve into how individuals can navigate their journey toward recovery. First, diagnosis. Diagnosing GAD involves a comprehensive assessment by qualified healthcare professional. This may include a thorough discussion about symptoms, their duration, and their impact on daily life. A mental health professional will also explore any underlying factor that could be contributing to the anxiety. Next, professional help. A range of mental health professionals can assist in the diagnosis and treatment of GAD. Psychiatrists, psychologists, therapists, and counselors are trained to provide guidance and support tailored to the individual's need. Third, therapy. One of the most effective treatments for GAD is therapy. Cognitive behavior therapy, which is CBT, is commonly used. It helps individuals identify and change negative thought pattern, teaching them healthier ways to cope with anxiety. Exposure therapy might also be used to gradually confront anxiety triggers in a controlled setting. After that, medication. In some cases, medication may be prescribed to manage GAD symptoms. Anti-anxiety medications and antidepressants are often used to help regulate brain chemistry and reduce anxiety. It is important to note that medication should be combined with therapy for the best outcome. Fifth, self-care and lifestyle change. Self-care plays a vital role in managing GAD. Regular exercise, a balanced diet, sufficient sleep, and mindfulness practice can contribute to overall well-being. Engaging in hobbies, spending time with loved ones, and setting realistic goals also help in coping with anxiety. Then, support network. Building a strong support network is essential. Friends, family, support groups can provide understanding, empathy, and encouragement. Talking openly about GAD reduces stigma and makes the journey toward recovery less isolating. Second last is long-term management. GAD is manageable condition, but it may require ongoing management. Regular therapy session, medication adjustment if needed, and consistent self-care practice are key to preventing relapse and maintaining process. Lastly, seeking help. If you or someone you know is experiencing symptom of GAD, remember that seeking help is a sign of strength, not weakness. Reach out to mental health professionals, helpline, and support groups for guidance and support.
So, to understand general anxiety disorder even better, let us hear from Aisha, one of my friends who had gone through anxiety since she was 15.
My name is Nur Aisha. So I've been under psychiatrist follow-up since I was 15, and currently I'm 20 years old. So I realized that I have anxiety when it affects my daily activity. Due to my previous trauma, it makes me make a bigger mistake during my childhood lah. So when I'm not getting any treatment, I make the situation even worse, and it affects my mental and also my ability. That is when I started to seek for psychiatrist help. So during my therapy session with my psychologist, we do counseling session, and also she does taught me lots of techniques to deal with my stress. Like one of them is the breathing technique. For the breathing technique, it helps to manage my stress lah. During the session, let me explain about how does it feel to have a panic attack. So whenever you have panic attack, you feel like shortness of breath, you feel like you want to faint, and you feel like you're getting heart attack lah. So because of that, my psychologist taught me on how to breathe properly to control my breath.
What are the things that you share with your psychologist?
It's about my past. I mean, like things that I usually won't share with other people because I know they are very trustworthy, and the way they respond to me is acceptable.
How do you cope with your anxiety after finishing your therapy to avoid new episodes of anxiety?
I mean, it doesn't just finish after I finish my therapy lah. It has been a very while until I adapt to it. But before I'm getting better, I've been going through like lots of other breakdowns after the therapy as well. But things get better lah. But I've learned to do self-reflection every night to deal with my stress and anxiety. And also I do the breathing technique lah. Whenever I feel like the stress is coming, I do the breathing technique. It helps to control the aggression, and then it also helps me to respond well to people.
So, when we talk about this generalized anxiety disorder, there's two types of debunking myths. The first one is it's just normal worrying. So, the generalized anxiety disorder GAD people goes beyond everyday's worries. It involves excessive and uncontrollable anxiety that can interfere with their daily life. So the second one, myth or debunking myth is people with GAD are weak. No, GAD is not a sign of weakness. It's a complex medical condition caused by emotions, caused by a combination of factors that is included by genetic, brain chemistry, and also their life experience.
After that, for seeking help and support. If you or someone you know is grappling with generalized anxiety disorder, remember that you don't have to face it alone. Seeking help and finding support are essential steps toward managing and overcoming this condition. First, recognizing the signs. If you find yourself experiencing persistent worry, restlessness, physical tension, or any of the other symptoms we have discussed, it might be time to seek professional guidance. Next is professional help. This can help you navigate the challenges of GAD and develop coping strategy. After that, helpness and resources. If you are unsure where to start, these helplines can provide information, support, and guidance often 24 hours. Fourth, talking to loved one. Do not hesitate to open up to friends, family, or trusted person in your life about your experiences. Sharing your feelings and seeking understanding can provide immense relief and strengthen your support network. Then, online community. Online support communities and forums offer a space to connect with others who are navigating similar experience. Sharing stories, tips, and encouragement can help you feel less alone on your journey. Next, self-care and coping strategies. Engaging in self-care activities and developing healthy coping strategies is crucial. Whether it is practicing mindfulness, exercise, or pursuing hobbies, these activities can positively impact your mental well-being. After that, passion and persistence. Remember, progress takes time. Be patient with yourself and the process. There may be ups and downs, but each step you take towards seeking help and support bring you closer to a better life. And lastly, breaking the stigma. By seeking help and sharing your experience, you contribute to breaking down the stigma surrounding mental health. Your courage inspires others to seek the help they need, fostering a more compassionate and understanding society. That's all from me. Thank you.
So, in understanding generalization anxiety disorder, there is a debunking myths which involve dispelling false and incorrect about belief by providing accurate information and evidence that contradict those beliefs. It's a way to challenge misconceptions and provide a clear understanding of particular topic. In the context of generalizations, anxiety disorder or generalized anxiety disorder GAD, these debunking myths would involve addressing and correcting common issues, which is always make misunderstandings about the conditions to provide accurate information to the audience about these diseases. So the second one on how we can promoting understanding and empathy within these GAD people is creating a supportive environment. This environment will impact really big to the GAD people as they really need a support. So simple act of understanding like giving a space when needed and being patient to them and also avoiding the judgment especially. And these all things can help the individuals which have GAD to feel more comfortable seeking help and managing their conditions to their surrounding, especially the environment. So last but not least, here's some of the promoting and understanding and empathy as a normal people that we can do to support these GAD people. So the first one is the let's 4-step empathy. So empathy can make a significant difference in someone's journeys which they have a GAD. We can do listening and offering a support and validating their feelings. Not just us, but our friend. Start from our friends, family, and society can contribute on supporting their recovery of GAD by doing some of the things that I say just now.
In conclusion, generalized anxiety disorder (GAD) is a complex and debilitating condition characterized by excessive and uncontrollable worry, also heightened anxiety. It impacts both mental and physical well-being, often leading to impaired daily functioning and a diminished quality of life. While the exact cause of GAD are not fully understood, a combination of genetic, environmental, and psychological factors play a role. Effective treatment approaches, including therapy and medication, can significantly elevate the symptoms of GAD, empowering individuals to manage their anxiety and lead more fulfilling lives. Also, to spread awareness, we as an individual who own a healthier mind and more peaceful mind need to give them support morally and physically and stop treating them as they are weak. We might not have been gone through what they have gone through, and personally I believe that everyone has their own challenges in their life, and we need to support each other to maintain and to reduce the number of GAD patients. I believe that's all from me and my team. Thank you.
Disclaimer. Please remember that this video is intended for the informational purpose only. If you are someone who are struggling with this GAD, it is better for you and really important for you to consult more further with a qualified healthcare professional to get more accurate diagnosis and personalized guidance for your GAD. So that's all from us. Thank you so much for lending us your ear and have a nice day.